There is a popular saying, my people perish for lack of knowledge. It's in the Bible. A lot of pregnancies are lost today because of ignorance, because our mothers are not knowledgeable enough. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Miss Mary, popularly known as a nurse with the difference, and I make learning easy and accessible for all my viewers. Today I'm going to be sharing with us the danger signs of pregnancy. Danger signs of pregnancy that you should take note of as a pregnant woman. I'm taking this topic today because 2 lives are involved. Not just one. 2 lives are involved, the life of the mother and also the life of the baby. So that is why I am going to take my time today to explain the danger signs of pregnancy. In case you see 1 or 2 of these signs, rush to the hospital as soon as possible to avoid further complications. But before I go into details into this class, if you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mary saying thank you. Let's go there. Welcome back. Like I earlier said, today we are going to be talking about the danger signs of pregnancy, so you know, and take prompt actions to avoid the complications that are likely going to pop up if care is not taken or if urgent attention is not given to it at that particular moment. So the first danger signs of pregnancy I have to share with you is bleeding. Yes, bleeding. I know a lot of people watching my video will be like, Nurse Mary, you said implantation bleeding is normal. Implantation bleeding is likely going to... Yes, implantation bleeding is normal in pregnancy. It takes place within that very first month of pregnancy, the very first weeks of pregnancy. That is when implantation bleeding takes place. And implantation bleeding is not heavy. Implantation bleeding is not heavy. It's not a heavy flow that lasts for days. Implantation just lasts for a few days, and also it is light. It is not heavy. So implantation bleeding is different from this bleeding I'm going to be discussing in this particular video as the danger signs of pregnancy. And the causes of the bleeding that are likely going to happen after 2 months, 3 months of pregnancy is, the first one is placenta previa, and the second one is placental abruptio or abruptio placenta. We all know that the placenta covers the baby. It's through this placenta that the baby gets the nutrients it needs. It's through this placenta that this baby gets the oxygen it needs. So when there's something wrong with the normal positioning or the normal attachment of the placenta, that can result in bleeding in pregnancy. First of all, in placental previa, the placenta is covering the cervix. When the placenta is covering the cervix, it's covering the opening of the uterus, that can lead to bleeding, and that is a danger sign, and that is what needs to be reported to the doctor. And we also have what is called a placental abruptio. In terms of the placental abruptio, it simply means that the placenta is pulling away from the uterus. The placenta ought to attach itself to the uterus, but all of a sudden the placenta is withdrawing itself from the uterus. That can lead to bleeding. So placenta previa, placental abruptio can lead to bleeding in pregnancy. So when you notice an abnormal bleeding outside implantation bleeding in pregnancy, please and please try and see your doctor. Try and rush to your doctor. And also, somebody asked me a question: is implantation bleeding every month? No, implantation bleeding occurs at that first weeks of pregnancy. It is not every month. So you take note of and avoid all these troubles and avoid the complications that are likely going to arrive with it. So if you notice any bleeding at all and you're not comfortable with it, straight to the doctor for proper medical attention. Then the second one I have to share with you is convulsion. If you see a pregnant woman, or you are a pregnant woman, you're having convulsion, you are shaking, you're unconscious, the pregnant woman is still, sometimes you see foam coming out from their mouth, please and please, that can be, or that is, eclampsia. take this woman to the hospital as soon as possible to avoid further complication. I know you've been hearing of preeclampsia and eclampsia. Preeclampsia, you see protein in the urine, you see high blood pressure. If preeclampsia is not treated as soon as possible, it can result in eclampsia. So if you are a pregnant woman, you are having severe headache, you are having blurry vision, you are not seeing things clearly, everywhere is looking blurred to you, you are having headache, your blood pressure is high, it is advisable you see your doctor. When you get to your doctor, they will do some urine tests, they will do some blood tests and find out what is really wrong. Then the third one I want to share with you is severe pain, severe abdominal pain, severe pelvic pain. So if you are pregnant and you are having severe pain, please see your doctor. Please and please see your doctor. Don't just assume it's normal. Yes, it is normal for you to feel pain in pregnancy. It is normal for you to feel pain when you are pregnant. But if this pain is severe, it is advisable you see your doctor for proper confirmation and adequate scan to know what is wrong with you at that particular moment. If you are having pain, see your doctor. I will always tell my subscribers, it is better for you to go and see the doctor and the doctor say everything is fine than for you as a human being or a woman to assume everything is fine and something is wrong. So if you're having severe abdominal or pelvic pain, please and please try to see your doctor. Why I'm saying try to see your doctor is because this abdominal pain may be a sign of miscarriage, may be a sign of abortion, may be a sign of threatened abortion. The abortion has not taken place, but if you don't see them on time, the abortion might take place. So it may be a sign. So try as much as possible to see your doctor as soon as you can. That is my advice generally to all pregnant women. If you notice anything strange from the normal, see a doctor. Then the other sign I have to share with you, which is the fourth sign now, is difficulty with breathing. Difficulty with breathing. If you notice you are having difficulty with breathing, you are forcing yourself to breathe, see a doctor. You are forcing yourself to breathe. See, pregnancy is not an ailment, it's a blessing. Yes, I know during this pregnancy period, tiredness comes in. You see a lot of, if you are having difficulty with breathing, you breathe normally now, breathe in and breathe out. All of a sudden you're like it's taking a lot from you breathing. Any small exercise, difficulty with breathing, you are unsettled, you can't breathe properly, please and please see a doctor. Because when you as a woman cannot breathe properly, you won't be able to get the necessary oxygen, and your baby will not also get that necessary oxygen needed for her to survive, needed for him to survive. So if you are having difficulty with breathing as a pregnant woman, don't be told, go to the hospital. Then the fifth sign I have to share with you, you know, when the baby is 20 weeks and above, you start seeing kick, that the baby start kicking, that joy you have. Like some even get to see that baby kicks from less than 20 weeks. So if after 20 weeks or less than 20 weeks, you started seeing your fetal movement, but all of a sudden, the movement reduced drastically. The movement reduced. It's different from the normal movement you used to hear. It's different from the normal movement you used to feel. Please, don't be told, see the doctor. Reduced fetal movement might be, oh, this baby is lacking one or two things. This baby is no longer active. It might mean something is wrong with the baby. Nobody prays for something to be wrong with a pregnant woman's baby. But if you notice reduced fetal movement, your baby is not moving like the way he or she used to move in your womb, please don't be told, see the doctor. Then the sixth point I have to share with you, right, is the sixth point, yeah, is swelling. When your hands are swelling, your legs are swelling out of proportion, they keep increasing, see your doctor. Please, it's me that's begging you, see your doctor to avoid complications and to avoid losing your baby or your life as a pregnant woman. It's not really easy. It's not an easy journey to be a pregnant woman. So it will be very painful, even if it's 1 month pregnant, even if it's 1 week pregnancy for a woman to lose that. So whenever you notice something abnormal, see your doctor. The last sign, which is the seventh sign I would like to share with you, is too weak to get out of bed. You are pregnant, but you are just too weak to get out of bed. You don't want to. I know sometimes fatigue, malaise, it's normal for it to come. You feel tired, you feel exhausted. But if it gets to a situation you are just too weak, you can't even move your body to get out of bed, you are immobile, see your doctor. Pregnancy is a blessing. Pregnancy is not an ailment, not a terminal ailment that should make you immobile for you to remain in the bed 24/7. Pregnancy is a blessing. So when you notice that you are on the bed 24/7, you are unable to move, you are unable to do anything, I know you are going to have reduced activity. You are not going to be able to function effectively well like you normally do. You understand? But if it's on the extreme, to the extent that you are on bed throughout the day, see your doctor. Yes, because as the pregnant woman, you need that exercise. You need to even move about. You need to exercise your body to stay active. For your cardiovascular system, your respiratory system to be active, you need to even move about. So when you notice something like that, see your doctor. So these are the danger signs of pregnancy I have to share with you, which are bleeding, bleeding, convulsion, pain, it could be abdominal pain, it could be pelvic pain, difficulty with breathing, reduced fetal movement, swelling in the upper limbs or lower limbs, that is your legs and hands, and also inability to get out of bed. So these are what I have to share with you today. Thank you very much for staying tuned. Thank you very much for watching my video. Don't forget to like, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nosime saying thank you. Bye, and see you in our next video.